So a lot of patients come in with chipped or broken teeth, and the first thing we think of is, what's the most conservative approach we can take to fix that patient's tooth? In other words, if you have a small little corner off a tooth, we're thinking we don't want to place a crown or a full, maybe even a full veneer on that tooth. We might just be able to use direct bonding, add what's missing to the existing tooth, and be super conservative with that. That material is called direct bonding or composite bonding. Works really well, looks amazing. It'll last about maybe 5 to 7 years, maybe 10 years if you take care of it really carefully. The next step up is if there's more tooth missing, let's say half the tooth or a pretty big section, we can do a ceramic veneer, which is bonded the same way as a composite restoration, but the material is much stronger and more durable and will hold its shine and polish and translucency much longer. And that process takes 2 visits because we use a lab to do that. Typically costs a little bit more, but the end result is wonderful either way. You just get one that's longer lasting. We usually reserve that for teeth that are fractured a little more aggressively, or a bigger piece of tooth missing, or maybe correction of crowding or worn teeth or things like that. So basically that's how we take care of chipped teeth.